So, hello, Dr. Vlad. It's really nice to have you here with the occasion of the ketamine-assisted therapy training that we're doing in Barcelona that we just finalized today. And it's a great honor to be interviewing you today. And I would like to start asking you, who is Dr. Vlad?
Well, I'm a medical doctor, psychotherapist, also PhD in stress of aging. And I'm founder of Center for Psychotherapy, Psychosomatic and Psychedelic Medicine, EXPIO, which first in Ukraine in 2018 started to apply ketamine-assisted psychotherapy. And I did it before. I did it because in our clinical practice we met many cases of treatment-resistant conditions, like depression, anxiety, PTSD, which were very badly or at all not possible to manage with traditional treatment. And we were looking for something new to apply. This was one reason. And another reason is because my direction with psychotherapy is transpersonal psychotherapy, which involves work in altered state of consciousness. And of course, psychedelic medicine is exactly about altered state of consciousness. It has very big potential. So when it became available, when international treatment protocols appeared with ketamine, we decided to start it, and we found it's really very efficient. Why ketamine? Ketamine is a legal medical remedy which since mid of last century actively been used in anesthesia and surgery, but it's a period that except of only pain management, it also has unique abilities of create psychedelic state, similar to what creates such a known psychedelic things like LSD or psilocybin mushrooms. And by using this altered state of consciousness, it is possible to do very deep treatment. What I mean, usually not many people have quick results with psychotherapy. And this is particularly that we all have so-called systems of psychic defense. We don't want to connect our traumas, our problems, so our mind protects us from digging into it. And usually it takes a long time to have a trust with psychotherapist and an art of psychotherapy is to reach these deeply buried traumas, to release them. With psychedelic treatment, it all happens much faster and more efficient, because we open our mind, we open our hearts, and we're able to reach these deep buried traumas and process them much efficiently. I'm using a metaphor that if we compare the usual psychotherapy with digging just with regular tools like in the garden, then with ketamine-assisted therapy, we're using like excavator, big machine to dig it out. So this was the reason for connect our work with ketamine. But except of usage in psychotherapy, ketamine has also a good pharmacological effect. It means that it helps to decrease the level of stress hormone glutamate, neurotransmitter in brain, and it's also helped to restore a connection between neurons, and under the ketamine influence, neurons became better connected. They originate new connections, and it's stabilize work of brain, increase cognitive functions. So it's in two directions we get better result for therapy. And that's why we choose ketamine.
Thank you so much. So your clinic is in Kiev, in Ukraine, and we all know what a terrible situation you're currently living there. And I understand you're treating many cases of post-traumatic stress disorder in your clinic. Is it different, the preparation these patients need when they're going to do this kind of treatment? Can you tell us a bit about the preparation and how you're specifically treating cases with PTSD?
Mm-hmm. Well, first of all, we need to make a clinical diagnostic to find if person has PTSD, if it's not only anxiety or panic attacks. And when we make sure that it is, then depending on how heavy state of patient, we choose a strategy. Usually we do first some session of psychotherapy where it's, again, patient can establish a therapeutic connection, alliance with psychotherapist. And then we start with a low dose ketamine to acquaint patient with the action of ketamine. So because if one didn't have any psychedelic experience, no altered state of consciousness, and for people in a high anxiety level or PTSD, it can be frightening experience because suddenly your world starts to change around you, and you need to be prepared. So we make like educational session to explain what will happen, what may happen, how we behave, what you need to do, what does it mean, and what we are going to do, how we are going to work. So people come prepared, and after they come in through the first introductory session, they're ready for infusion, for full sessions. Full sessions we do using infusion, intravenous infusion. It's lasts for 40 minutes usually. And during this time, psychotherapists directly work with the patients and helps to access those deep traumas or problems which patient cannot manage with usual instruments. After active stage of the work, usually we connect patient for about 30 minutes with music, and during this time they slowly recover from action of ketamine and coming back to normal state of consciousness. Then medical doctor or anesthesiologist check the patient if it's totally okay before we let them go out of clinic.
How many sessions do they require in order to see some improvements?
It depends on how heavy the state. If we speak about resistant depression, PTSD, middle to heavy level, usually it's 8 to 12 sessions with the preliminary integrative or analytic sessions, which means that psychotherapist will speak with the patient what is changing in his state or her state, how they feel, what has popped up, what's remembered, because often ketamine works not only in the exact process of infusion, but the so-called enhanced state of perception or neuroplasticity. It lasts for several more days. During the days, patient can usually get some new insights, new emotions, changes attitude, and this should be used in therapy, like fixed the new states, and with each session we move forward to reaching some level of improvement.
When very intense emotions arise during a session, how do you manage?
We help with different instruments. We help them to process it with breathing, with body movements, with processing with imagery. So there is some professional tools which are all patient in a safe environment, address these emotions and release them without being overwhelmed with. Also, ketamine by itself would help to process it less traumatically.
As I mentioned before, we're here because of the ketamine-assisted training that the three organizations have been have organized, and I'd like to know how your experience has been during this week. And yeah,
Yes, it was great to be here with colleagues, professionals, to exchange experience and to know how colleagues works, to know some details which they developed, and to share our details of our work. And I think for me, as the doctor who already worked with it for 6 years, it was more important, some nuances to learn from colleagues. But for those who came first time, it was definitely very precise information from very experienced professionals who run this for many years. And I'm sure it's really worth to come and experience and learn. So now people can start their own practice and help many others.
very good. So, as we know, you're doing work in Ukraine, and you have a big mission of making these treatments available in the public healthcare system. Can you tell us a bit about this proposal?
Yes. At the moment in Ukraine, like in many other countries, ketamine used so-called off-label, which means that it is not yet included in national protocols for treatment, let's say, resistant depression or PTSD. And that's why state hospitals, including military hospitals, they don't use it in their practice. And as we are observing very good results in our practice, particularly for militaries, for veterans who has PTSD and depression, we want to bring this information to our authorities, medical authorities, to Ministry of Health, let them know that it's a new direction, it works to apply and widely used, because when the war will finish and many warriors will come back to normal life, they will have a lot of difficulties, and it is clear that with the traditional methods of therapy that will be very difficult to manage with it. So we want to make our clinical research of veterans as PTSD using ketamine. And unfortunately, in current state of war, it's impossible to get from state money for this clinical research, and we hope to get some support with some foundations or charities who would be interested to finance our treatment, because it will be important not only for Ukrainians, but also this result will be important for any country, because even if there is no military actions, there are always police, firefighters, and people who can develop PTSD. So our knowledge will be shared with those who need it.
Oh, thank you so much. It's really inspiring, the work that you're doing, and we really wish you the best of luck as you accomplish this soon. And yeah, would there be anything else you would like to add?
The times are changing, and what was yesterday prohibited or considered as something awful, like for many people, psychedelic is still the same that just bad drugs, and it's very important that new understanding comes that these substances are not drugs, that they not create dependency, craving, that it is really healing tools which can help us to heal our traumas, our soul pain, and not just eat, but also develop ourselves, develop our understanding of who we are and what is our place in this world, and find new perspectives in our life. And I really hope that we all together will be moving forward this new knowledge, new science, and get benefit from this.
Thank you so much. Thank you.
Thank you very much.